All right. Now, to continue our lesson for the first part of cholinergic agents, we'll now be talking about the section on acetylcholine mimetics, also known as muscarinic agonists. All right. No, acetylcholine mimetics, these are drugs or these are agents that mimic the action of acetylcholine when it binds to a receptor, specifically your muscarinic receptor. So expect the following responses: smooth muscle contraction, which leads to, for example, in your glands, which leads to the secretion of fluids. Another is vasodilation, increased secretion of exocrine glands, meiosis, and decreased heart rate and force of contraction. Now, to better understand the action of acetylcholine binding to the muscarinic receptor, um, just remember the phrase: when the parasympathetic division is activated, rest and digest. So what are the responses of the body when you rest and digest? So first, for a better picture of the possible responses, let's start with your saliva flow. So can you predict what happens to the saliva flow when the parasympathetic division is activated? So if your answer is stimulated saliva flow, then your answer is correct. So tandaan lang ninyo, rest and digest. So during eating, during digestion, increased secretion. So one of them, we have increased saliva or stimulated saliva flow. Another, in terms of your pupils, will it dilate or would it constrict? Meiosis or mydriasis. So for the parasympathetic division, when it is activated, your pupils would constrict, meiosis. Next, how about the heart rate? During rest and digest, what happens to your heart rate? Would it increase or would it decrease? So of course, during the resting state, your heart rate is decreased. So expected that it would slow down your heart rate, bradycardia. Next, how about for your bronchioles? So does it undergo bronchoconstriction or bronchodilation? So if your answer is bronchoconstriction, then it is correct. How about for in the case of your GI tract, specifically your stomach? So does it is it related to increased peristalsis and secretion or decreased peristalsis and secretion? So during rest and digestion. So ibig sabihin nito, there is an increased rate of peristalsis and secretion along with the increased bile release. And the last one, in terms of your bladder, urinary bladder. So during rest and digest, ano ba nafe-feel ng tao? Does the person feel ba niya mag-urinate or hindi? So the correct answer is bladder contraction causing urination. So those are the specific responses of your parasympathetic division. So to better remember the effects of the parasympathetic division when activated, so remember lang tayo sa dumbbells. Dumbbells, it stands for diarrhea, including diaphoresis, U for urination, M for meiosis, constricted or pinpoint pupils, bradycardia, if muscarinic, emesis, causing nausea and vomiting, lacrimation, lethargy, and salivation. Now, focusing on tachycardia, or rather, sorry, on the B for dumbbells. So, nakalagay dito, bradycardia if muscarinic, tachycardia if nicotinic receptor. So, remember natin yan. Bradycardia if ang acetylcholine magbind sa muscarinic, and tachycardia if magbind sa nicotinic. So this one, it's like an issue for some drugs. So there are some drugs na tinatawag natin non-selective. When we say non-selective agents, so pwede siya mag-bind to either muscarinic or nicotinic receptor. Ibig sabihin nito, unpredictable ang kanyang effects. So that's why earlier, o doon sa first video, na-mention doon that there are agents that are selective for the muscarinic and also agents that are selective for the nicotinic. So greater selectivity of the drug, lesser incidence of possible unpredictable side effects. So opposite siya in terms of your cardiac muscle for both nicotinic and muscarinic receptors. All right, now I'll focus more on acetylcholine. Now, acetylcholine, it is again the neurotransmitter that is involved in the responses mentioned earlier. So when it binds specifically to the muscarinic receptor, it causes the dumbbells side effect. Now, ang acetylcholine, the problem with your acetylcholine is that hindi siya selective lang sa muscarinic receptor alone, but it's a agonist at both muscarinic and nicotinic receptor. So ibig sabihin nito, it is non-selective for both receptors. So ang mangyari, may mga effects na hindi natin ma-predict. Another thing or another problem with acetylcholine is that it undergoes rapid hydrolysis in aqueous solution. That is why if it is prepared, it should be administered immediately, because in solution form, hindi siya stable. And additionally, even if it is parenterally administered, action is fleeting as a result of hydrolysis by esterases, like your butyryl cholinesterase, also known as the plasma cholinesterase. So as you can see here, medyo malaki ang problem pag acetylcholine lang alone. So first problem kay non-selective siya. And another is that it is unstable in solution form. Tapos additionally, it is easily degraded by esterases. So ibig sabihin nito, ang action niya is short-lived lang, fleeting ang kanyang action. So that is why may mga agents, may mga synthesized drugs tayo that would mimic the action and structure of acetylcholine binding to its receptor, pero it would bypass the following disadvantages. Okay, so this is the structure of your acetylcholine. Now, our agents for acetylcholine mimetics, they form their basis on the prototypical structure of acetylcholine. So as you can see here for acetylcholine, it has a quaternary ammonium group. The presence of a quaternary ammonium group in any molecule, it renders it water-soluble. So going back to our lesson in prelims, kapag water-soluble ang drug, it's best if it would be administered parenterally. Now, once again, pag parenteral ang acetylcholine, kay easily siya degraded by esterases. So problem pa rin siya. Okay, so oral, hindi siya pwede or hindi siya suitable i-oral kasi once again, it's water soluble because of the quaternary ammonium group. So hindi siya suitable for oral. How about for topical? Ang topical absorption of acetylcholine is not guaranteed. So best option nito, it's via the parenteral. Pero yun nga lang, short-lived siya. So that's why we have agents that would bypass those disadvantages. So paano ba gi-create ang mga different agonists, muscarinic agonists na related sa structure ni acetylcholine? Now, they based it on the three domains or the three essential parts in the structure of acetylcholine. So they checked on these three essential parts. So they checked on the first one, the quaternary ammonium group. The second one, it's the acetoxy group. And the last one, they checked on the ethylene bridge. So they modified part of the structure of these three domains. Tapos, from there, may mga new agents tayo. So later on, I'll be explaining what are those agents na result of the modification of the acetylcholine molecule. So mo na siya ang focus sa Org Medchem, focusing more on the structures that causes a difference in its therapeutic effect and benefit. So ang tawag doon, structure-activity relationships. So how does the structure relate to its activity or to its effect? So we have, again, the three domains in the acetylcholine structure, quaternary ammonium group, ethylene bridge, and the acetoxy group. Acetoxy, kay dalawa man siya ka-carbon. Now, I'll start first with the modification of the quaternary ammonium group. So ang ginawa, gimodify nila ang structure of the quaternary ammonium group with the main aim of altering its possibility kung pwede siya i-oral. Kay mamanggo siya ang dahilan kung bakit naging water-soluble ang acetylcholine. So, ang ginawa, they replaced it, yung nitrogen, they replaced it with arsenic, phosphorus, sulfur, or selenium. Pero the end result of this modification is that it is less active and it is not used clinically. So reject siya. Another possible modification is from single or from methyl groups, it is replaced with ethyl groups. From methyl to ethyl, instead of a cholinergic agonist, naging cholinergic antagonist siya. So it's the opposite. So reject again for this modification. Another, when only one branch, when only one methyl group is changed into a straight a branch with more than 3 carbons. Or 3 carbons, kumbaga, sorry, 3 carbons. So it affords an active compound but much less so than acetylcholine. So hindi siya ganun ka-efficient. So reject ito siya na modification. So i-change nila from a quaternary ammonium group, they change it to NH, NH2, or NH3. So this one, it leads to successively diminishing muscarinic activity. So NH4 pa rin, the quaternary ammonium group is essential. So reject to siya ng modification. Okay, next, we have the modification of the ethylene bridge. So itong sa gitna. So ethylene bridge, it is composed of 2 carbons. Ethyl, dalawang carbons. Now, their suggestion was to modify it by increasing the number of carbons, increasing chain length. Pero the problem was that increasing chain length decreases the activity of the molecule. So reject siya. This one. Another, or rather, ang rule daw pagdating sa ethylene bridge is that they follow the rule of 5. According to the rule of 5, there should be no more than 5 atoms between the nitrogen and the terminal hydrogen atom for maximal muscarinic potency. So ang numbering, it's as follows. So as you can see, tamang-tama lang talaga ang distance from the quaternary ammonium group to the end hydrogen. So dapat wala kang i-add or wala kang i-increase sa chain length. So ang possible lang na pwedeng ma-modify sa ethylene bridge is by adding branches to the two carbons. So what they did, they added an ethyl group to this part here. So replacement of hydrogen with alkyl groups, ethyl group for example, larger than methyl leads to less active compounds. So kumbaga, this kind of modification is reject na pod. Another possible modification is by the addition of a methyl group. Single lang na single lang na carbon. Now, the addition of methyl group on the beta carbon. So, ang tawag dito na part, beta carbon to siya. So, ang reference ninyo is at the quaternary ammonium group. Ang sunod na carbon dyan, it's called the alpha carbon. Ang susunod sa alpha carbon, it's the beta carbon. Now, it is said the addition of a methyl group on the beta carbon affords acetyl beta methylcholine, also known as methacholine. Now, this modification, it's a good modification. It resulted to a much greater muscarinic potency. So go siya. It's a good modification. Actually, one of the muscarinic agonists includes the drug methacholine. So it has a greater muscarinic potency compared to acetylcholine. So mo na siya. Another modification that was made is the addition of a methyl group to the alpha carbon. Now, the addition of a methyl group to the alpha carbon, it resulted to a much greater nicotinic than muscarinic potency. So, hindi ito yung desired natin na activity. So, X siya for the alpha carbon. All right. So this one is details about the modification at the ethylene bridge. So I'll not anymore elaborate on this one. Next, the last domain on the structure of acetylcholine, we have the modification of the acetoxy group. Kani siya, kaning ester na group dere. Now, according to the rule of 5, enough lang siya na dalawang carbons. So when the acetyl group is replaced by higher homologs, so ibig sabihin greater chain length, resulting esters are less potent than acetylcholine. So hindi siya okay. So this modification is a reject kapag you increase further the chain length. So replacement of an acetoxy group with a functional group resistant to hydrolysis was the main aim in the modification of the acetoxy group. Kasi it is said daw na because of the ester functional group found in your acetylcholine, this is the group responsible kung bakit easily hydrolyzed ang acetylcholine. So therefore, if you change the functional group, this acetoxy functional group with a functional group that is resistant to hydrolysis, ibig sabihin nito, you are able to formulate an oral compound. Kasi ang problem man nito ang problem with your acetylcholine itself kay dili siya pwede i-oral, kay easily siya degraded. So kapag i-change siya with another type of compound, possible na ang kanyang oral bioavailability is better compared to the prototypical structure. So ang ginawa, they changed the acetoxy group to a carbamate functional group. From an acetoxy, ginawa siyang carbamate functional group. Now the resulting product, ang tawag dito, it's called your carbachol. Now a carbachol, it is a carbamic ester of choline. So because of the addition of a carbamate group, so this one is now resistant to hydrolysis. And additionally, ang carbachol, it's also a potent cholinergic agonist. So as you can see, because of the following modifications, na-alter yung mga or kumbaga, na-bypass yung mga disadvantages mentioned earlier. Yung non-selective siya for both muscarinic and nicotinic. So na-alter siya at the ethylene bridge, and ito siya, the addition or the rather the substitution to a carbamate ester resulted to an orally bioavailable product kasi resistant na siya to hydrolysis. Alright? So this one, it's the result of your modification of your acetoxy group. So esters derived from carbamic acid, they are referred to as carbamates, and they exhibit greater stability against hydrolysis. Thus, they can be administered orally. All right, so this is the summary of the SARs for muscarinic agonist activity. So I'll not anymore elaborate on this one to save time. So can you read na lang on your own. All right, so this time let me show you the different structures that was given a go signal when it comes to structure activity relationship. So this one, it's the addition of a methyl group at the beta carbon. So this one, it has a more potent muscarinic than nicotinic activity. So selective siya for the muscarinic receptors. But the problem with this molecule is that it has an acetoxic group. So hindi siya pwedeng i-oral, but the only option is parenteral. Pero ang kanyang action, it's somewhat like transient lang because of hydrolysis. Another modification is this one, the addition of a methyl group at the beta carbon and the substitution to a carbamate. So this one, aside from greater muscarinic activity, it has also a greater oral stability. So pwede siya i-orally administer. And this one, it's your acetylcholine molecule. So as you can see, yung dalawang na mentioned earlier, it bypassed the disadvantages of using acetylcholine alone. So this time, let's proceed to the different drugs. So first, we have your specific muscarinic agents. So these are the agents or drugs that are the result from the modification of the acetylcholine molecule. We have methacholine, carbachol, bethanicol, pilocarpine, and cevimeline. So from the structure of acetylcholine, na-change siya. So initial modification, the addition of a methyl group at the beta carbon, ang tawag dito, it's called your methacholine. Next, the alteration of the acetoxy group to a carbamate group, it resulted to the drug carbachol, and the combination of the two, the addition of a methyl group at the beta carbon and the substitution rather to from an acetoxy to a carbamate group, ang tawag dito bethanicol. Greater muscarinic plus greater oral stability for bethanicol. All right, so these are the drugs for specific muscarinic agonists. So ang mga i-mention ko lang dito are mga important na descriptions for each drug. So first one, methacholine chloride. Now methacholine, it is chemically known as acetyl beta methacholine. So it is a selective muscarinic agonist with very little activity at your nicotinic receptors. Ang important lang na information na hindi nakalagay dito for methacholine is that ang methacholine, it is used in the so-called bronchoprovocation test. Bronchoprovocation test. Ang bronchoprovocation test, it is a test used, one of the tests used in the diagnosis for asthma. Ibig sabihin nito, if reactive ang bronchioles ninyo, If mag-constrict ang bronchioles with the help of methacholine, possible na asthmatic ang pasyente. So used siya via inhalation for the diagnosis of asthma. Methacholine. Another drug, we have carbachol. Now, carbachol, it is a carbamate analog of acetylcholine. It has an affinity to both muscarinic and nicotinic receptors. Pero the advantage of carbachol over methacholine is that it is orally stable. Kay more resistant siya to hydrolysis. Ang carbachol, it is used in the treatment of glaucoma and for the induction of meiosis. Okay, next drug, we have bethanicol chloride. Now, bethanicol, it's like the combination of the first two agents. It is a carbamate analog of methacholine. Ibig sabihin nito, selective din siya for muscarinic receptors, and it is also orally administered. Now, bethanicol, it is approved for the treatment of post-surgical and postpartum urinary retention and abdominal distension. Okay, fourth one, we have pilocarpine. Now, pilocarpine, it has an affinity for the M3 muscarinic receptor. Now, when we say M3, again, ang M3, these are glandular muscarinic receptors. So something to do with your secretions. Now, it is approved for the treatment, or it is the miotic of choice for open angle glaucoma. And it is also used in the following conditions. It is used for the treatment of xerostomia, or yung tinatawag, or the medical term for the dryness of the mouth, Sjogren's syndrome, and mucositis following chemotherapy. So kumbaga, ang pilocarpine utilize siya to stimulate secretions from your lacrimal glands, from your salivary glands, and the like. So by the way, na-mention earlier ang condition na glaucoma. When we say glaucoma, a short overview lang, it's a condition wherein there is increased intraocular pressure. So nagkakaroon ng increased intraocular pressure because of the accumulation of the fluid of a specific type of fluid in your eye. So with the help of your muscarinic agonists, so once again, they promote secretion from your glands. So pwede siya makarelieve sa pressure na nag-accumulate sa inyong eyes. So atong mga muscarinic agonists, they are indicated for glaucoma. Okay, so this one is additional information lang with pilocarpine. And the last drug for specific muscarinic agonists, we have cevimeline hydrochloride. So cevimeline, it is a non-classic muscarinic agonist kasi it has a different structure talaga compared to acetylcholine. So it's a quinoclidine derivative. It is active at M1 and M3 receptors. It is orally administered for the treatment of xerostomia and Sjogren syndrome. Elimination half-life, it's 3 to 5 hours. Okay. Hello. Okay. So to summarize your specific muscarinic agonists, first one we have methacholine. So specific activity at the muscarinic receptors, but not orally administered. Carbachol, it is non-selective for muscarinic and nicotinic, pero it is orally stable. Third one, bethanicol. Ang bethanicol, it is specific for the muscarinic receptors and orally stable din siya. And the other drugs, pilocarpine and cevimeline. So muscarinic agonists. So by the way, itong naka-encircle dito, it's the quinupridine part of cevimeline. All right, next part for muscarinic agonists, those agents mentioned earlier, itong 5, those are direct-acting muscarinic agonists. So pag direct-acting muscarinic agonist, they directly bind to the receptor, producing or eliciting a response. So this time, let's proceed to those agents that are indirectly acting. So they act by inhibiting the enzyme that would otherwise hydrolyze acetylcholine, rendering it inactive. So ang tawag sa kanila, we have acetylcholinesterase inhibitors. So bale, ito lang yung end part for my discussion. We'll end with your acetylcholinesterase inhibitors. Now, in the market, we have a lot of acetylcholinesterase inhibitors, and they are generally categorized into 2. We have reversible and irreversible acetylcholinesterase inhibitors. So I'll start first with your brief description of acetylcholinesterase inhibitors in general. Acetylcholinesterase inhibitors, they inhibit the rapid hydrolysis of acetylcholinesterase, therefore increasing the concentrations and the levels of acetylcholine in the synapse. So making it available for both muscarinic and nicotinic effects. So kumbaga, ang ating mga acetylcholinesterase inhibitors, they are non-selective. Kaya ang acetylcholine ani na result ani kay pwede siya mag-bind to muscarinic and nicotinic receptors. So by the way, the byproduct or rather the result of the hydrolysis of acetylcholine by acetylcholinesterase, we have acetic acid and choline. So, yung figure na mention sa first video na ang choline, mo ni siya ang ma-recycle balik sa pathway para ma-reuse siya to form another acetylcholine molecule. All right. Now, other names of acetylcholinesterase inhibitors are anticholinesterases or indirect cholinomimetics. Now, these are the indications of acetylcholinesterase inhibitors. They are therapeutically used to improve muscle strength in myasthenia gravis. Next, by the way, ang myasthenia gravis pala, it's a condition wherein, or it's an autoimmune disorder wherein your muscles, or rather, it results to muscular weakness. So because of the lack of acetylcholine. So we have acetylcholinesterase inhibitors. Next, it is used in open angle glaucoma because once again, acetylcholine binding to the muscarinic receptor kaya mag-stimulate siya og secretions. Especially for, in the case of glaucoma, for your lacrimal glands, decreasing the intraocular pressure or IOP for short. Acetylcholinesterase inhibitors, they are also recently used for the treatment of the symptoms of Alzheimer's disease. And last one, it is used extensively as insecticides and as chemical warfare agents. All right, so this time, let's proceed to the first type or first division among your acetylcholinesterase inhibitors. We have the reversible acetylcholinesterase inhibitors. Now, you may wonder bakit sila gina-refer as reversible and irreversible. From the name itself, reversible siya in a sense na hindi permanent yung pag-inhibit niya sa acetylcholinesterase. So for a certain period of time lang siya. Unlike the irreversible na it would take more than days, more than 1 day ang pag-inhibit sa acetylcholinesterase na enzyme. So first one, for your reversible acetylcholinesterase inhibitors, we have the following drugs: physostigmine, neostigmine, pyridostigmine, carbaryl, and etrophonium chloride. So mechanism of action of your reversible acetylcholinesterase inhibitors, these compounds that are substrate for and react with acetylcholinesterase to form an acylated enzyme. Now, the acylation of the enzyme, the acetylcholinesterase, it's not permanent. Eventually, ma-break off niya ang acylation. Kaya siya reversible. Okay? Now, eventually, bakit siya reversible? Kasi mag-regenerate manggod ang acetylcholinesterase na enzyme. However, our newer agents, they are not focused more on acylation because, once again, ang acetoxin na group kay hindi siya stable. So we have newer agents na we have those aryl carbamate. Yung carbamate, presence of a carbamate functional group. For example, in the drug physostigmine. Now, pag carbamate, it resulted to a carbamylated enzyme. So, ang pag-carbamylate sa acetylcholinesterase kay results to the inhibition of its action. Pero once again, hindi siya permanent. Kasi eventually, um, ang acetylcholinesterase kay mag-regenerate siya. Regeneration of its active form. Alright, so nakalagay dito sa baba, regeneration of active acetylcholinesterase by hydrolysis of carbamylated enzyme is much slower than hydrolysis of the acetylated enzyme. So that is why ang available sa atin ng mga acetylcholinesterase inhibitors, specifically the reversible ones, kay mga carbamate esters. Kasi medyo dugay-dugay siya. Expected na ang half-life niya kay longer compared to an acetylated one. Okay, so despite the longer time required to regenerate the carbamylated enzyme, the active form of acetylcholinesterase is eventually regenerated. So ibig sabihin, temporary lang. Therefore, ang tawag sa kanila, reversible. Kasi ang mga irreversible, kay medyo matagal, tapos there are cases na hindi na mag-regenerate ang acetylcholinesterase. So later on, I'll be giving you what are those irreversible. Pero this time, let's focus more on the reversible. So examples of the reversible acetylcholinesterase inhibitors are the following. First one, physostigmine. So physostigmine, it was mentioned earlier, it inhibits acetylcholinesterase by acting as a substrate and carbamylating the enzyme. It is more lipophilic than any other acetylcholinesterase inhibitors, and it is used for the treatment of glaucoma. Another thing is that since it is more lipophilic, ibig sabihin ito, longer lasting siya because of its lipophilicity, it can be used for the treatment of overdoses of compounds possessing anticholinergic effects. So how would you counter anticholinergic? With the help of a cholinergic drug. So example, physostigmine. So mo na siya. Structure of your physostigmine, it's presented below. Kaya siya lipophilic because if you would check at its carbamate group, this one here, kay dalawa lang siya ka carbon. So rendering it lipophilic. All right, next part, we have neostigmine. Next drug, neostigmine. Now, neostigmine and the third drug, pyridostigmine. Ang neostigmine and pyridostigmine, these are two drugs that are indicated for the treatment of myasthenia gravis. Again, neostigmine and pyridostigmine, they are indicated for the treatment of myasthenia gravis. Now, neostigmine, it lacks central activity. So wala siyang action at the CNS, partly because of the structure. If you would look at its structure, it contains a quaternary ammonium group. So ibig sabihin nito, pag may quaternary ammonium group, it renders the compound water-soluble. So kaya siya lacks central activity. Elimination half-life is 15 to 90 minutes, and it's indicated for the prophylaxis of post-operative abdominal distension and urinary retention, myasthenia gravis, and the reversal of neuromuscular blockade or muscular weakness. Third one, pyridostigmine. If you would check on the structure of pyridostigmine, it has a tertiary amino group. So, ibig sabihin nito, lipophilic siya compared to neostigmine, therefore making it orally effective, and it has a longer duration of action and a lower incidence of side effects. So, I'm sorry pala. All right. Another thing with your pyridostigmine, meron pa palang additional slide. Aside from being orally effective, it is also administered parenterally to reverse the effects of non-depolarizing neuromuscular agents. So, partly because namangod siya charge na nitrogen. So kapag charge ang atom, kay ionic siya. So pwede siya water soluble siya. So mo po na ang reason kung bakit daw siya parenterally administered. And elimination half-life, it's 1 to 2 hours. All right, next we have carbaryl. Carbaryl, it is a reversible carbamate-derived acetylcholinesterase inhibitor. It is used as an insecticide for use in houseplants and vegetables for the control of fleas and ticks on pets. Actually, good later on our lesson for irreversible acetylcholinesterase inhibitors. Ang ating mga irreversible acetylcholinesterase inhibitors, they are predominantly used as insecticides. So yun lang. And the fifth reversible acetylcholinesterase inhibitor here, it's the drug edrophonium chloride. Edrophonium chloride, it is a quaternary ammonium substituted phenol. So this one is it's water soluble. It does not carbamylate acetylcholinesterase kasi wala siya carbamate group, pero it inhibits it in a reversible manner. Kung ang neostigmine and pyridostigmine, they are used in the treatment of myasthenia gravis. It is used intravenously for the diagnosis of myasthenia gravis. It is also used intramuscularly for the reversal of the effects of non-depolarizing blocking agents, and the elimination half-life is 1.3 to 2.4 hours. Now, you may wonder, may nakalagay kasi dito, non-depolarizing blocking agents. Now, ito siya, mga drugs na mga non-depolarizing neuromuscular blockers. These are actually under nicotinic blockers, which is actually the last part of the topic for cholinergic agents. So, medyo last pa na sila. Pero nakalagay na dito siya. So, acetylcholinesterase inhibitor, it's an antidote for a nicotinic blocker. So, yun siya. Reversible acetylcholinesterase inhibitors. But a subpart of the reversible ones are used for the management and treatment of Alzheimer's disease. So we have the following: tacrine, donepezil, rivastigmine, and galantamine. Now, for a brief overview lang of Alzheimer's disease. Alzheimer's disease, it is a special case of dementia. When we say dementia, it is memory loss. Now, it is said daw, one of the physiologic mechanisms kung bakit daw nagkakaroon ng Alzheimer's disease, it involves the reduction of the neurotransmitters. So examples of the neurotransmitters depleted are acetylcholine, serotonin, norepinephrine, dopamine, and glutamate. So with the help of acetylcholinesterase inhibitors, specifically, it would control and it would maintain the levels of acetylcholine. Now, we have 4 acetylcholinesterase inhibitors approved for the treatment of Alzheimer's disease, which was already mentioned earlier. So these are the following. First one, tacrine. So on tacrine, it was the first reversible acetylcholinesterase inhibitor na recognized or approved for Alzheimer's disease. Pero the problem is that it is hepatotoxic. That is why ang kanyang use is limited. So, mo na siya na dili kay siya gina-prescribe, tapos we have newer agents that replace tacrine. Another drug for Alzheimer's disease, we have donepezil. Donepezil, it is a non-classical, centrally acting, reversible, non-competitive acetylcholinesterase inhibitor for the treatment of mild to moderate Alzheimer's disease and dementia. It has a longer elimination half-life compared to tacrine, and it has no potential for hepatotoxicity. Another drug, we have rivastigmine. Now, your rivastigmine, it is a centrally selective aryl carbamate acetylcholinesterase inhibitor for the oral administration of Alzheimer's disease. So it inhibits acetylcholinesterase for up to 10 hours due to the slow hydrolysis of the carbamylated enzyme. And the last, sorry pala, last one. Designation also for rivastigmine kay, it's also called a pseudo-irreversible acetylcholinesterase inhibitor. No, ngano siya pseudo-irreversible? Kay, for a thing, ang irreversible inhibitors manggod of acetylcholinesterases, ang kanilang effects would last for more than hours. Tapos, as you can see here, it inhibits the acetylcholinesterase for up to 10 hours. So medyo matagal siya compared to a typical reversible one. So kaya siya tinatawag na pseudo-irreversible acetylcholinesterase inhibitor. And the last one, we have the drug galantamine. Galantamine, it's a reversible acetylcholinesterase inhibitor. It's a tertiary amine, making it lipophilic. Therefore, it's able to cross the blood-brain barrier, going to the CNS. It is used for mild to moderate Alzheimer's disease and dementia. It is not associated with hepatotoxicity. Another thing about galantamine kay, it is non-selective also for the nicotinic receptors, giving it a dual cholinergic action. Pero if you would look at it in a general overview, ang ating talagang mga acetylcholinesterase inhibitors, non-selective sila for muscarinic and nicotinic receptors. So yun siya, ang ating mga reversible acetylcholinesterase inhibitors na indicated for Alzheimer's disease. Tacrine, donepezil, rivastigmine, and galantamine. And we have the last part for this video. We have the irreversible inhibitors of acetylcholinesterase. Examples: isoflurofate, ecothiophate iodide, and insecticidal acetylcholinesterase inhibitors, which includes malathion, parathion. Now, ang ating mga reversible earlier, they act by either acetylation or carbamylation because they contain acetoxy or carbamate groups respectively. Pero ang ating mga irreversible acetylcholinesterase inhibitors, they are best described as phosphate esters. Now, eventually sa reversible, di ba mag-regenerate man ang acetylcholinesterase via hydrolysis. Pero the thing about phosphate esters is that ang kanilang hydrolysis is much slower compared to a phosphorylated enzyme. Kaya tinatawag silang irreversible inhibitors. Kailang action is more than a day, more than 10 hours, ganun. All right. Another thing about phosphorylation of acetylcholinesterase is that it can undergo a process known as aging. When we say aging, it is by sense kung saan eventually hindi mag-regenerate yung phosphorylated na enzyme. So eventually, walang action ang esterase. Hindi niya gagampanan ng kanyang role. Kasi wala na ang esterase. Hindi siya mag-regenerate from aging. So, muna siya ang problem with regards sa ating mga insecticides. So, eventually, if untreated, so muna siya, walang acetylcholinesterase causing muscarinic toxicity like increased secretions from your sweat glands. Muna siya ang common na symptom, yung sweat, yung grabe ang pagpawis, and secretions from the other glands. Tapos mag-decrease ang heart rate. So muna siya ang problema sa paggamit og mga insecticides na irreversible ones. So kapag exposed ka for a long period of time, tapos untreated or unmanaged, muna siya ang toxic. So because of this mechanism of action, it led to the development of deadly phosphorus-derived chemical warfare nerve agents. So muna sila. We have sarin, tauban, and soman. So ang main aim dito was to prevent the regeneration of the acetylcholinesterase. Okay, eventually, without the acetylcholinesterase, mag-accumulate ang acetylcholine, causing those muscarinic effects earlier na mentioned. Alright, so drugs under irreversible acetylcholinesterase inhibitors are the following: isoflurofate. Isoflurofate. So ito ang information with isoflurofate. Wala masyado akong ma-add. Okay. Now, isoflurofate irreversibly inhibits acetylcholinesterase. Its activity lasts for days and even weeks. Now, the treatment in cases of toxicity with isoflurofate, remember it's a muscarinic agonist by indirect action. So therefore, to counter its toxicity, you can give an anticholinergic. So it would oppose the effects of your cholinergic agonists like atropine sulfate. Ang magnesium sulfate, it addresses the possible seizures na related sa acetylcholine toxicity. So isoflurofate also additionally has been used for the treatment of glaucoma. Another drug, we have ecothiophate iodide. Ecothiophate iodide, it is used for the treatment of glaucoma and strabismus. It is applied topically as a solution, and it is the only irreversible acetylcholinesterase inhibitor na considered daw to be safe for the treatment of glaucoma. So it lasts rather up to 4 weeks. But the problem with your ecothiopate is that it is associated with the formation of cataracts. So kumbaga, para siyang last line na for the treatment of glaucoma if unresponsive siya with earlier agents. And the last one for irreversible acetylcholinesterase inhibitors are your insecticidal acetylcholinesterase inhibitors. So they are extremely lipophilic. So that is why kapag mag-spray daw nito sa plants, kay dapat daw wear ng protective clothing. Like, kaya siya gina-advise na mag-wear ng plastic. Kaya kapag plain clothes lang, pwede mag-absorb siya through the skin kahit nakadamit lang. So plastic ang advice. Extreme caution in the presence of humans to prevent inhalation of the vapors or skin absorption. Now, itong mga insecticidal acetylcholinesterase inhibitors are thiono compounds which would be rapidly bioactivated to form its oxo derivative, which are quite potent. So again they should be handled with extreme caution kaya pwede siya mag-absorb to the skin. So symptoms of possible toxicity with acetylcholinesterase inhibitors, specifically the insecticidal ones, are related to the muscarinic effects: nausea and vomiting, excessive sweating and salivation, meiosis, bradycardia, low blood pressure, and difficulty of respiration. So specifically, the last part mo ni ang concern, yung pagbaba ng heart rate at saka yung difficulty in breathing. Alright, so these are the following insecticidal acetylcholinesterase inhibitors. The first one, it's your malathion. Eventually, ang malathion, it would produce its active metabolite, the malaoxon. So it would be bioactivated to its oxon derivative. So it is used both as an aerial insecticide and as a miticide for the topical treatment of hair, scalp, and scalp lice infestations. So ginagamit siya as an insecticide because it is bioactivated to its toxic form, toxic metabolite, which is proven to be toxic in insects. Next one, we have your parathion. So parathion, it is used as an agricultural insecticide and is a weak cholinesterase inhibitors. So ang parathion, eventually it would be metabolized to its active form called paraoxon, which is a more potent inhibitor of cholinesterase. And another one, we have shradan. Ang shradan, the advantage of shradan is that it is hydrolyzed by acids. So therefore, let's say man in case lang na ma-ingest siya ng tao, so ingestion reaches the GI tract or stomach, so ma-destroy lang siya sa stomach acids. It is used as a systemic insecticide for plants, being absorbed in plants without appreciable injury. Insects feeding on the plant are incapacitated. And the next one, the last one, for antidotes of irreversible acetylcholinesterase inhibitors. No, ang kanilang effects kay related siya sa muscarinic side effects. So therefore, one of the possible antidotes kay anticholinergic to address the side effects. But how would you address the source, yung mismong pag-inhibit or pag-inactivate sa acetylcholinesterase, we have a specific antidote for that one. So ang specific antidote niya, ang basis niya, it's on the chemical hydroxylamine. So from hydroxylamine, eventually na-afford ang drug na pralidoxime. So mo na siya ang antidote for our irreversible acetylcholinesterase inhibitors. Kaya ang atong mga anticholinergics, they would just address the symptoms. Pero mismong cause of the symptoms, the drug pralidoxime addresses that one. So other names, 2-PAM, or chemically known as 2-pyridine aldoxymethyl chloride. It is a clinically effective antidote for poisoning caused by phosphate ester acetylcholinesterase inhibitors. Additional info lang about pralidoxime. It is administered subcutaneously, intramuscularly, and intravenously. But notes lang dito is that lethal reactivation is likely if it is given 36 hours after exposure. Tapos, if the phosphorylated acetylcholinesterase enzyme has aged, 2-PAM will not regenerate the enzyme. So, time limit or time range sa paggamit ng pralidoxime. Alright, so that concludes our lesson on muscarinic agonists. So muscarinic agonists, we have those specific agents, those that would directly act at the receptor, and then we have your indirect acting agents, those that would act at the enzyme to prevent the hydrolysis of acetylcholine. Now, ano na siya, murag activity lang na ako ni siya. So on your end, I hope you can identify it. So identify if the agent mentioned in the slide is a muscarinic agonist, a reversible acetylcholinesterase inhibitor, or an irreversible one. All right, first one, how up for rivastigmine? Sa tingin niyo, saan na belong ang rivastigmine? So you may pause if you want to. So the answer for this one, rivastigmine, it's under reversible acetylcholinesterase inhibitor. Ang additional note lang kay rivastigmine, it's also known as a pseudo irreversible acetylcholinesterase inhibitor. Kaya ang iyang effects, it would last for more than or at 10 hours. The drug bethanicol. So ang bethanicol, it's a muscarinic agonist. So bethanicol, it is a drug that has affinity specifically for the muscarinic and it is orally active. Next one, we have physostigmine. Ang physostigmine, if your answer is letter B, then it is correct. It is a reversible acetylcholinesterase inhibitor. Next one, how about ecothiopate? So for ecothiopate, if your answer is irreversible, letter C, then that is correct. It's an irreversible inhibitor of acetylcholinesterase. It's considered to be the last line for the management of glaucoma because of the possibility of the formation of cataracts with ecothiopate. And how about edrophonium? So edrophonium chloride, if your answer is letter B, that is correct. It's a reversible acetylcholinesterase inhibitor. Specifically, ang edrophonium, it is indicated as used for diagnosis of myasthenia gravis. And the last one, I guess, How about pilocarpine? Okay, so ang pilocarpine, it's identified as a muscarinic agonist. Alright, so yun lang for a short activity. So on our next lesson, we'll continue it by discussing the different acetylcholine antagonists, yung mga anticholinergics natin. So I hope you somewhat nakagrasp mo konting knowledge about our muscarinic agonists. So if you have any questions, feel free lang to ask. Tapos we'll have the continuation on our second, or rather on our last synchronous meeting for midterms. So thank you all for listening. Goodbye.